Good morning, everyone. My name is Yunhong. I would like to introduce my group members, Hua, Hana, and Xinyi. Today, we are going to discuss the health issue of Aboriginal and Torres Strait Islander people who live in remote areas of Australia. Warning: this presentation may contain names, image, voices, and film of Aboriginal and Torres Strait Islander people who are now deceased. In this presentation, Hua is going to talk about health care needs of Aboriginal and Torres Strait Islander people, especially from remote areas. Hannah is going to identify the health issue of cardiovascular disease, also called CVD. Also, she's going to explain the considerations of culturally competent and safe nursing practice. Xinyi will finally discuss the links between control and Aboriginal Torres Strait Islander health, and she will focus on relevant Aboriginal and Torres Strait Islander social determinants of health. This presentation is to focus on connections between Aboriginal and Torres Strait Islander control and health. To point out Aboriginal and Torres Strait Islander social determinant of health that influence cardiovascular disease. Furthermore, we are going to discuss nursing considerations to be followed to practice culturally competent and safe care for Aboriginal and Torres Strait Islander health based in remote areas. According to Aboriginal and Torres Strait Islander population 2017, in the above image, it can be seen 2.8% of Australian population are Aboriginal and Torres Strait Islander people, which around 650,000 people. Also, Prime Minister Report 2018 explained that over the past 10 years, Closing the Gap campaign has been implemented effectively for Aboriginal and Torres Strait Islander people's disadvantages, but we need more contribution and planning to be applied. Aboriginal and Torres Strait Islander people have major barrier to access healthcare services, such as available of transport and cost of public transport. These insufficient supports impact people access to health facilities when they are unwell, especially children and old people. Also, the transport costs are much higher than people living in non-remote area, whereas the remote average incomes are much lower than non-remote area. As recent study has shown, a Department of Prime Minister and Cabinet 2014, consideration for poor environmental standards, limited education and low income in the remote areas. People with low income always have less opportunities to achieve high qualities of healthcare and education, which will result in high percentage of CVD in remote area. Also, there are many high-risk factors of CVD in remote community, such as tobacco use. Smoking is one of the main factors to contribute to CVD among Aboriginal and Torres Strait Islander people. Obesity is an overall global issue, but in the group of Aboriginal and Torres Strait Islander people at remote area, the rate is much higher than people living in non-remote area. Dietary behaviors is the most main health issue from Aboriginal and Torres Islander people. They are from diet habits and high in saturated fats in food, leading a lot of health issues such as CVD, as recent evidence suggests from Australian Institute of Health and Welfare 2015.
I will talk about cardiovascular disease as the health issue of Aboriginal and Torres Strait Islander people. According to Australian Institute of Health and Welfare 2015, Aboriginal and Torres Strait Islander people have a higher rate of cardiovascular disease than non-Indigenous people. It is reasonable to state that cultural factors are a significant part of developing cardiovascular disease. For instance, risk factors of prevalence of cardiovascular disease include poor nutrition, insufficient physical activity, overweight, alcohol consumption, and smoking. Therefore, providing health care should focus on cultural perspective and rectify all high risk factors in order to improve health outcome of Aboriginal and Torres Strait Islander people. In addition, the prevalence of cardiovascular disease in remote areas was 10% higher than in non-remote areas. Consequently, cardiovascular disease contributes significantly to poor health and reduced life expectancy among Aboriginal and Torres Strait Islander people. As a result, in order to close the gap between Aboriginal and Torres Strait Islander people and non-Indigenous people in health outcome, Aboriginal and Torres Strait Islander people living in remote areas are required to be provided with high quality of education and health service.
Hi everyone, my name is Hua. I will talk about the health need for Aboriginal and Torres Strait Islander people in remote areas. The purpose of this health promotion is to close the health and life expectancy gap for Aboriginal and Torres Strait Islander people, which will reduce the prevalence of cardiovascular disease. As mentioned before, the research has shown that the prevalence of cardiovascular disease in remote areas is higher than in non-remote areas. Also, according to Commonwealth of Australia 2013, this outcome is because of Aboriginal and Torres Strait Islander people have a lack of education, inadequate food intake, and malnutrition. Thus, the Aboriginal and Torres Strait Islander people are required access to health service and high level of education related to personal health care of cardiovascular disease, with the support of healthcare professionals who can enhance their ability to make informed decisions, care planning, and undertake the health action to achieve their health and quality of life. In addition, according to Nursing and Midwifery Board of Australia 2016, this is respect for and recognition for cultural difference of Aboriginal and Torres Strait Islander people to provide culturally safe and appropriate approaches across all the elements of prevention and care to support Aboriginal and Torres Strait Islander people. It also could overcome the cardiovascular disease, including information to support healthy lifestyles, as well as McMurray and Clarendon 2015 explained that it is topical for remote people to feel a sense of ownership of service in their local area, and this often creates a closer interaction between Aboriginal and Torres Strait Islander people and health professionals. Moreover, health promotion and education minimize the government health expenditure and also develops health awareness of Aboriginal and Torres Strait Islander people related to cardiovascular disease. Now, my group member Yixin will introduce her part.
My part is to introduce the links between culture and the Aboriginal and Torres Strait Island health and their social determinants that impact on cardiovascular disease. Firstly, I'm going to discuss the connection between cultural and Aboriginal and Torres Strait Island health. Generally, it is more specifically to talk about how culture impacts on Aboriginal people. The culture of Aboriginal and Torres Strait Island people has significant influences on developing Australian history. The reason why it has significant impact is because their culture enables Australian government to generate ideals and improve health. Therefore, it is necessary to conduct in-depth study on how does their culture influence on the high rate of cardiovascular disease. The cultural diversity of Aboriginal and Torres Strait Island people reflects in the distinct language, kinship, cultural traditions, religions, and family responsibilities. This cultural diversity contributes to the collective society perspective. Australian government aims to have comprehensive understanding on different culture in order to improve the health for Aboriginal and Torres Strait Island people. All in all, when the government empowers the health promotion on community base, the Aboriginal people are able to receive a collective benefit from professional health care. Another point about cultural diversity is that it can affect the choosing of the professional health care because Aboriginal and Torres Strait Island people are aware of racism when they are receiving treatment. Australia Health Minister Advisor Council's National Aboriginal and Torres Strait Island Health Standing 2016 said that evidence shows that Aboriginal and Torres Strait Island people are more likely to access health services, where services providers communicate respectfully, build good relationships, have an awareness of the underlying social issues, as well as some understanding of culture. Also, Aboriginal and Torres Strait Island people have their own perspective of health and illness. For instance, they are likely to have traditional healers in partnership with the Western medicine. The combination of the healers and Western therapy can improve the Aboriginal and Torres Strait Island people's satisfaction. Secondly, I'm going to talk about the Aboriginal and Torres Strait Island social determinants of health that impact cardiovascular disease. Before I start this part, it is important to understand what is a social determinant. According to WHO 2011, the social determinants are function of the circumstance in which people live, work, and grow, largely shaped by the distribution of resource and power. These determinants are closely linked to and mediate exposure to environmental risk factors, such as working conditions, housing, water and sanitation, or healthy lifestyles. Access to health food is a global political issue because global market controls the food supply. However, the higher rate of cardiovascular disease of Aboriginal people is because of the poor nutrition as well as the lack of healthy food supply. Wilkinson and Mamo 2003 state that excess intake, also a form of malnutrition, contributes to cardiovascular disease, diabetes, cancer. Generally, the affordable healthy food is more important than health education. Transportation is an important factor that Aboriginal and Torres Strait Island people can access the health services. In remote areas, the availability of public transport is below the standard, and the Aboriginal and Torres Strait people has difficulties to afford the cost of public transport. Aboriginal and Torres Strait Island 2014 indicates that limited or no public transport options significantly impact on the capacity to access specialist health care, particularly for patients with chronic health conditions in rural and remote areas. There are two socio-economic positions that I'm going to mention for social determinants. Australia Institution of Health and Welfare 2016 said that, in general, people from poorer social or economic circumstances are at a greater risk of poor health, have higher rates of illness, disabilities, and death, and live shorter lives than those who are more advantaged. Aboriginal and Torres Strait Island people in remote areas lack of educational attainment. A good start in education enables people to acknowledge the fundamental adult health. Besides this advantage of education, it also enables people to have employment and secure income. The combination of two advantages improve not only their health but also support their family in order to have adequate housing, healthy food, and health services. The high rate of unemployment happening in Aboriginal and Torres Strait Island people depends on their education attainment, skill level, poor health, and discrimination. Unemployment is the key factors that indigenous people encounter low income. When they experience unemployment status, they have big risk on financial hardship and also may cause psychological problems.
I am going to identify nursing considerations to be followed to practice culturally competence and safe care for Aboriginal and Torres Strait Islander health based on remote areas. First of all, CrossCare 2013 states that cultural competence and safe nursing care is defined as integrated concept, which provide healthcare service based on cultural recognition and respect. According to Nursing and Midwifery Board of Australia 2018, it states that nurses have a numerous influence of better health outcomes of Aboriginal and Torres Strait Islander people by improving the cultural safety of nursing practice. The main focus of safe nursing care is to improve awareness of cultural, social, and historical aspects for them. By doing so, nurses are able to show respect and understand their culture. Therefore, professional communication skills are pivotal factors to build an intimate relationship and interact with Aboriginal and Torres Strait Islander people. Nurses must be encouraged to continue to upskill communication skills, not only verbally but also non-verbally. Bones and Rowis 2013 argued that the aim of cultural respect is to advocate the rights of Aboriginal and Torres Strait Islander peoples to maintain and support their culture and achieve equity of health outcomes.
Hi, this is Hua again. In conclusion, the socio-economic environment conditions in remote areas have a significant influence on developing cardiovascular disease for Aboriginal and Torres Strait Islander people. Examples of social determinants of health include lack of transport option, food inefficient, low income, and education. Also, it is important to understand that the cultural factors of Aboriginal and Torres Strait Islander people may lead to having high risk of cardiovascular disease in remote areas. Because the recognized mainstream health service is unsafe for them. Moreover, the process of health promotion is the best control action for Aboriginal and Torres Strait Islander people to access to health service and higher education. In addition, nurses need to support, respect, and enhance Aboriginal and Torres Strait Islander people's health, and to provide cultural safety in order to make informed decisions, care planning, and undertake the health actions necessary to promote their well-being. In summary, as a future registered nurse, I will raise awareness to the cultural diversity of Aboriginal and Torres Strait Islander people related to their health issue of cardiovascular disease. Also, we must have competent communication skills, which enable nurses to deliver the appropriate treatment for them. Developing therapeutic relationship between nurses and Aboriginal and Torres Strait Islander people is an important aspect of negotiating the problem associated with health issues, as well as we need to provide ongoing support to maintain cardiovascular disease health for them. This is our reference list. Thank you for listening.